Okay, gosh, my timer went off so fast. Seems like it was so fast. I'm going to set it again, but what I was in the middle of saying, I think, was that when people have a legal crisis, they often are required to attend some kind of a treatment program, and that is often referred to as a diversion program or diversion sentencing, to avoid, going to jail or serving jail time. And so, again, being arrested and having to go to a day reporting center or something like that would definitely, be a crisis for somebody who's living in addiction, and a crisis for their family. I want to continue to mention that. Lastly, there might be a psychological crisis that you're finding is sort of the most important part of what you're seeing with a client in addiction. And so, this, again, the psychological suffering from addiction, or living with somebody and loving someone who's addicted, is really a very serious thing. Sometimes depression can be a part of the addictive behavior, or a result of the addiction, living with the addiction. And often, of course, we know that people do too also self-medicate using substances that are depressants, ironically, to just medicate themselves, to not feel the depression. So that's interesting. That whole sort of, constellation of behavior is something that is done a lot. It's important to know that over 50% of suicides are related to alcohol or drug dependence. And if it's a teenager or a young person, about 25% of alcoholics commit suicide. Let me say that again. 50% of suicides are related to alcohol or drug dependence, and 25% of alcoholics complete suicide. That number rises to 70% in adolescents. So wow, that just seems unbelievable, that 70% of adolescent suicides are related to drug or alcohol addiction. Wow. Why is alcohol abuse such a crisis? Well, it's the most commonly abused substance in the United States, and as we said before, it's it's cheap, it's very acceptable socially until it becomes a problem in a person's behavior, and so it's just a common crisis, right? Understanding the alcoholic, these are some things that are helpful for us to think about and know. That many people refer to alcoholics as a problem drinker, or you might hear them use alcohol abuser. There are some other more disparaging kinds of labels that people use, but certainly we wouldn't want to use those really in our field. But you might actually hear, if you attend an AA meeting or an NA meeting, you might hear people who are in recovery call themselves these names. So most people who work in the field believe that alcoholism is a disease. And so you might hear some reference to what people call the disease model of addiction. And this is the belief that it is a disease and not something that is a moral failing or weakness in a person. And I think probably this kind of the nature of this piece of information might be something that you would really want to think about and understand, that other people outside of our field, or family members perhaps and loved ones who don't have problems with addiction, might just have this misunderstanding that it really is just a moral weakness, or a weakness in character, that this person can't just have a glass of wine at a party and stop, because they can. And so this is a point of education in this sort of constellation of crises that you may end up talking with someone about. Alcoholics, this is important, do seem to share a constellation of emotional feelings that are very, very, very commonly mentioned for people who are alcoholics. And these are shame, feeling guilt, resentment is a very big one, low self-esteem, disgust and anger, remorse. So all of these feelings are really a common constellation of feelings that people who end up drinking and having a problem with drinking or drug use seem to feel. And we'll talk about those feelings in a while when we talk about codependency. So they seem to share this constellation of negative feelings. And I must say, I think this is why a fellowship of treatment in a support group is so helpful, because often alcoholics and people with substance addiction feel like they're kind of unique, and that their suffering is kind of unique, and that they don't fit with regular people. And if they're in a fellowship, a constructive fellowship with other people who are substance abusers who share these constellation of emotions, they then can feel like they're part of something. And of course, the program that they're involved with needs to combat those exact negative emotions. And we'll talk about that more in a few minutes. When alcoholics stop using, these strong emotions actually, of course, still exist. The substance that they became addicted to was just really covering up those feelings and providing relief and comfort away from those really sad, terrible feelings, emotions that a person's living with. And so unless someone in recovery finds a way, a positive way, to combat those negative emotional feelings or states, they really are going to become what in the field is called a dry drunk. And this is a terrible phrase, but what it refers to is a person who's become sober and is in recovery, but who hasn't really taken advantage of any kind of treatment that helps them understand and combat these very negative feelings. And so they're living sober, but they're miserable, and their whole family and the people they live with are also miserable, because now the person, not only are they experiencing these emotions themselves, but the way they feel is affecting everybody around them. And this is a very important thing to understand about recovery. The principles of NA, Narcotics Anonymous, and AA, Alcoholics Anonymous, they're designed to directly confront and change these emotional states in a positive way. And so this is one of the most powerful things about these 12-step organized programs, is that I think, number one, my opinion is that it's a fellowship of people who really know exactly what you feel, and they know exactly why you used and became addicted, and they know exactly what your day is like trying to remain sober. And then there's just so much love and support in these programs. And thirdly, these programs combat the emotions that create the suffering. So this is really so amazing, and can be amazingly helpful to people who are trying to recreate their life without substance abuse. Okay, in my notes. This is why actually the entire family needs intervention, by the way, and support once the alcoholic becomes sober. So, this is dicey business, and, a lot of people will say, I don't need to go to AA, I don't want to go to AA. It's, they might just feel like it's stupid, or it's just a bunch of old people, or they don't really fit that paradigm. And, that is what it is. It is going to be what it's going to be. But for family members, if family members are willing to attend Al-Anon, this can give them the education that they need to, number one, understand what addiction is all about, number two, understand what seeking recovery is all about, and thirdly, and probably most importantly in my view, is family members then can understand how to change their own behaviors in relation to the substance abuser, so that they're not behaving inappropriately in ways that really destroy this efforts of sobriety, or in ways that just make it easy for the person to relapse. So family being involved in the recovery program and getting their own education, wow, it seems like it's half of the picture really there. Let's see. So some researchers suggest that 50 to 60% of causes of alcohol dependence is genetic, And so, as I said to you before, seeing this as a disease model, a physiological disease model, is part of it. But something that really caught my eye this time when I read this chapter is that experts also believe that in the early stages of using and abusing, and in early stages of addiction, it's really kind of more of an emotional and psychological disorder. And I think that's so interesting, and it really gave me pause to stop and think, what does that mean? And I guess to me it suggests that people who are using substances to such a degree that they are going to become addicted are probably doing it at first because it's recreational, but also probably because it's like a salve. It's like an ointment on pain. And so it reminds me of that whole discussion that we had a few moments ago about, numbing emotional pain, and how that really could be the psychological portion of this disorder in the early stages until it becomes a physiological addiction. Alcoholics often also strongly have strong dependence needs and anger and resentment needs and issues. And misusing alcohol soothes and kind of dampens down these kinds of emotions as well. And crisis workers should understand these emotional dynamics. To me, understanding these emotional dynamics is a huge part of sort of getting addiction and misuse and abuse of substances. And just reminding us that crisis interventionists who find themselves helping people, any of the people that are related to this circumstance, need to for sure create a feeling and an atmosphere of acceptance and non-judgment, safety, so that either the person who's living with the addiction or is trying to be in recovery, or family members or loved ones, feel that they can say the things they need to say and ask questions that they need to ask, and feel accepted and valued. It's important to understand how strong denial is in substance abusers, and I think I haven't mentioned this yet, but often substance abusers who are addicted and strongly invested in their life of addiction are going to minimize their use. They're going to be operating in really strong denial and a loss of hope, actually, and just probably have already tried several times to not abuse their substance and find themselves relapsing and doing it. And when they're doing it without any support or structure, it's pretty hard to get that accomplished. So there is manipulative behavior that is very, very common in people who are substance abusers. And I don't mean this in a negative way necessarily, or I don't mean this non-judgmental or judgmentally, but it's important for us to understand that when a person is actively addicted, getting their substance, using their substance, getting their substance again, using their substance again, getting their substance again is really kind of the cycle that they care about. And so, lying, stealing from family, denying how bad it is, hiding it, hiding use, all of these behaviors are manipulative behaviors that a person who lives in active addiction is going to tell you, that's what they do. Or they won't tell you that's what they do, but when they're in recovery, they'll tell you about it. So it's important as a crisis interventionist to just kind of understand that that's a part of the picture. And that kind of behavior is often chipped away at in recovery programs and certainly in treatment programs. To provide intervention for alcoholics and substance abusers, it's important for you to know that probably the most popular, really, intervention program is Alcoholics Anonymous. It's not for everybody, and so I would not want to push it for everybody, and I've certainly known many people in recovery in the years of teaching in this program. I've met several people who have gotten clean and sober without using any of the principles of NA or AA. They just have done it on their own. So I don't want to say that it can't be done at all without that, but it is definitely the most popular program of recovery and support for sobriety. And it's important for you to understand how it works, and to understand that it is a highly supportive and fellowship, communal, organizational. Wow, this time goes by so fast.